Hey guys, it's Ryan with your Medicare helper. Getting a lot of calls, questions, frustration about why is my supplement plan going up so much this year? Many of you out there have supplement plans, and a lot of you have supplement plan G. Not everybody, but a lot of you have supplement plan G. This is the most coverage that is available to you. With a supplement plan G, you pay a very small deductible. In 2025, that's $257, and everything else is covered with Medicare approved charges. So you pay very little. Now, historically, supplement plans have gone up 4, 7, maybe 9% a year, and that's been pretty typical. However, as many of you have noticed, this year we're seeing supplement plan increases, Medigap increases 10, 12, 15, 20% a year. In fact, there are even some areas of the country where supplement plans are going up 40% this year. So in this short video, I want to give you some context, some understanding of why is this happening and what can we do about it? Is there anything we can do to help this situation? So let's jump in. The first thing I want you to understand is about 11,000 people a day turn 65 in our country. Baby boomers are retiring in droves. It's been this way for about 4 to 5 years. We're kind of at the peak this year in 2025, but we do have about 4 or 5 years more of this happening. So when you have millions of people coming into the Medicare system and less federal dollars going around, that's a problem. That's an issue. Second thing that's happening is the claim exposure at age 65 has been increasing dramatically in about the last 3 to 5 years. And what we've noticed is maybe there was a time when folks had halfway decent employer insurance or private insurance. And if they needed that surgery, hip replacement, cataract, whatever it may be, at 64 years old, as they aged into 65, they did that with their employer insurance or with their private insurance. What we're noticing in the last few years, though, is a lot of employer and private insurance is not very good anymore. So a lot of people are waiting till they get on Medicare at 65. If they have that Medicare and that supplement plan G, they're paying $257 for their surgery, which is really, really great for the policyholder. The problem is, if millions of people are doing that, then the claim exposure at this age 65, 66 is going up a lot and causing these loss ratios to increase from these insurance carriers. Reason number 3 is the elective surgery period with COVID has been lifted. You know, from about 2020 to around mid-2023, you could not have elective procedures done, right? They were banned. Well, this has now been lifted in the last year and a half, 2 years. And so we're seeing lots of people go out and getting all of these surgeries and procedures done, which impacts the bottom line of insurance companies. Number 4, just inflation in general, rising cost of healthcare continues to dramatically hit these insurance companies and hurt their bottom dollar. And lastly, more states are adopting what's called the birthday rule. And I want to talk about that for a minute. What is the birthday rule? So currently, there are about 9 states across the country that have what they call the birthday rule. And what this means is every year, in a certain window of time on your birthday, you are allowed to switch or change your supplement plan without any medical underwriting. You are able to do that once a year, every year. In all the other, 41 states, you can't do that, right? Here in Arizona, as well as in 41 other states, there is no birthday rule, meaning the only time you're a guarantee issue for a supplement plan where there is no medical underwriting is when you first get Medicare Part B. You have a 6-month period where there is no underwriting. After that, anytime you want to switch plans, switch carriers, you have to go through medical underwriting and be approved. What we're seeing, however, is more and more states are adopting this birthday rule, which again is a wonderful thing for the policyholder because they can switch their plan, no health questions asked, which is fantastic. What you have to understand is the implication on a whole. What we're seeing then is insurance companies now have to accept everybody, regardless of their health. Doesn't matter. So if they're accepting people that have a lot of chronic conditions or comorbidities, and they're seeing doctors and specialists and having procedures done all the time, they're having to pay for those for that 20%. So their loss ratio percentage is increasing more and more and more. And really, at the end of the day, with any of these reasons, the only thing insurance companies can do if they're losing money is do what? Raise their rates and raise their premiums. So this is what's been happening out there. Wanted you to have some context and understanding. But what can you do about this, and what can we together do? So first thing is, we need to make sure that we're shopping our rates every year. And we really want to do this really around our effective date, which is oftentimes our birth month. Okay, a lot of misconceptions that we have to wait until the annual enrollment period to review our supplement plans. But remember, you can change your supplement plan year-round, anytime you want, as many times as you want. You just have to go through medical underwriting and be approved. So every year we want to start getting together around that birthday and see if there's a cheaper, better option for you. That's number one. The next thing is maybe it's time to look at lower coverage plans. For all of you that are out there on a G plan, maybe it's time to look at Plan N, which is a good plan, a little bit less expensive, a little bit less coverage. There's also a high deductible G plan, which may be a great fit for a lot of you, especially when you compare that with a hospital indemnity plan. So maybe we want to reach out, have a conversation together, talk about what other options you've got. Third thing would be, if costs are getting too prohibitive, maybe it's time to switch to a Medicare Advantage plan. This will usually save you premium on a monthly basis. Now you're going to have more out-of-pocket costs on the back end with all the copays, coinsurances, deductibles, but maybe that's something that we have to look at. And finally, friends, you just got to stay educated. Stay informed, okay? Make sure you're checking out videos on my website. Make sure you're following me on YouTube, following me on TikTok. There's my addresses down there for you to follow me on these things. I'm going to try to post a lot more content on a more regular basis so you can stay informed. Lots of things happening out there in the Medicare space. We want to stay educated and informed. Medicare is confusing. I can help.